Welcome to CR Arthritis 2025. My name is Ellen, and I am the Programs Coordinator at Arthritis Consumer Experts. Today, I am joined by Lindsey Puddicombe. Lindsey is a medical student at Dalhousie University, and she will be presenting at the CR Arthritis conference just a very, very short time away in the Clinical Pearls and Mysterious Cases section of the conference. So, Lindsey, thank you so much for joining us today.
Thanks for having me.
Lindsey, tell us a little bit about yourself and, how you got into rheumatology.
Yeah, so I'm from Halifax. I go to Dal med school, and we had some really great lectures last year. So we learned lots about rheumatology, and it's just really interesting, kind of involves the whole body, and I was really intrigued, and I got to do a few electives with some of like the wonderful physicians here in Halifax, and then I got to go to Toronto last summer to do a program with CRA, a studentship there. And I had some of the most like wonderful mentors and teachers there. So just I find it's like a great space to learn medicine, and it kind of touches every specialty, which is really amazing if you like to learn. And the people in rheumatology are so wonderful and kind. Yeah.
Absolutely. I think rheumatologists are the best specialty.
Yeah.
I may be a little bit biased here. It's really interesting though, you sharing your experiences. I didn't personally know that they had a studentship for the summer, but that would make sense. We want more medical students like yourself interested in rheumatology. So I'm so happy they're doing that.
Yeah, and I would like recommend it to everyone. It's like so wonderful. There's two streams. There's one for research, and then there's one that's like clinical, but you could just get to go and kind of like shadow rheumatologists who are like so wonderful. I don't think I've ever learned more in like the couple months I was there.
Well,
Yeah.
excellent. Well, that may
Yeah.
be something that we link to below in our video. If
Oh.
anyone's a medical student or you know of a medical student and they may be interested. So that way we can really get the word out. And with that, your presentation this year, I'm guessing, is based on your work, perhaps last summer, or your continued work with some of the rheumatologists that you met.
Yeah, so it's actually interesting. I wasn't like a part of this case, but I've been doing some research with one of the physicians here in Halifax, and one of the residents, Lucy and Dr. Legg, and so they kind of showed me this case, and it was really interesting. So I got to learn a lot about kind of what it was about, and then they said I could present it. And one of the residents actually has already presented it kind of in 2023, I think. So it's a really interesting case, lots of like learning points. Yeah.
Sounds very interesting. I will ask you about it, but
Yeah, okay. I'm not, I was like, I'm not sure if I should anyways, yeah.
yes, so it's titled An Unfolding Dilemma. That
Yeah,
sounds very mysterious. It does sound like an episode of a crime movie.
yeah.
Yes. What is this unfolding dilemma?
Yeah, so it's kind of, I think a lot of people in rheumatology deal with like the gray area of kind of not always knowing exactly what the diagnosis is, because some of the tests aren't, exact. So this one's about kind of, I guess, mimickers of inflammatory myositis. So someone one of the patients kind of had some of the signs that you would kind of be leaning towards myositis uh, in your head probably. So we just kind of talk about the overlaps between some presentations of medical conditions and rheumatic diseases. And I guess I can, so then the one that kind of overlaps with this is like amyloidosis. So it's pretty interesting. And I didn't know a lot about amyloidosis before because I don't think it's necessarily usually in the rheumatology field. I think it's more hematology and oncology that deals with that disease. But some of the presentations are, yeah, like rheumatic manifestations. So that's kind of why the team was consulted for this patient specifically. So it's really interesting. And there's like lots of cross-specialty involvement. Which is also kind of what I one of the things I love about rheumatology is that you're involved with like every part of the body, so you have to consult lots of people.
Yeah, absolutely. I think me coming into rheumatology, I'm still relatively new to this area. Like, I thought rheumatology was arthritis.
Yeah, yeah,
I'm like, it's arthritis, not quite. It's inflammatory conditions. Okay, well, what do you mean by inflammatory, right? It's like, well, it's systemic conditions. So conditions that manifest throughout your body, pretty much like nothing is off limits as long as it's in the body. So it's like when you think of rheumatology as a field, it is so broad. And like you said, in your example, and especially in your case, you have myositis. I understand what myositis is. You let me know if I'm right, Lindsey. So myo, muscle, itis, inflammation, inflammation,
exactly.
muscle.
Exactly, yeah.
Excellent. And then can you t share with us what is that second diagnosis? Amyloidosis?
Yeah, so it's basically when um so plasma cells are from your bone marrow.
Yes.
And usually they kind of function normally and release proteins, but when there's issues with those cells in your bone marrow, they release proteins that will fold kind of incorrectly. And they accumulate and then deposit in your tissues. And that can obviously kind of create lots of issues because, the proteins aren't supposed to take up space, but in some people they do. So they can kind of infiltrate like your heart, your kidney, lots of different parts of your body. So that's how it kind of um, presents. And it's a bit different because it takes usually a decent amount of time for it to happen. So then getting diagnosis is often delayed. Yeah.
Yeah, it's extra trick. I mean, rheumatology. A rheumatological condition is difficult to diagnose. But then if it
Yeah.
has, like you said, overlapping symptoms, manifestations, signs
Yeah.
as hematology or oncology, then
Yeah.
like what a conundrum we're in. Like you said, what a dilemma we are in.
Yeah, yeah, and I was like, I'm not an expert at all in this. I was like learning lots about it while kind of preparing, and there's like a lot of overlap with myeloma and amyloidosis. So like the treatment for amyloidosis, or at least the one I'll be talking about, which is like light chains, the most common one, is it can be chemotherapy actually, because you're trying to kind of suppress those cells in the bone marrow, which I thought was like very interesting because. Yeah, but I guess it makes sense, but yeah.
Like you said, in the medical specialties, there's a lot of space in between the medical specialties that we're still like slowly uncovering.
Yeah, exactly. Yeah.
Absolutely fascinating. And this year, right on par with the theme is Ascending to New Heights, Peaks of Innovation in Rheumatology. Lindsey, can I ask, what are you most interested or excited to see at the conference yourself? Like, what is the latest innovation? You're like, ooh, that sounds so novel.
Oh, well, I think I was looking at the names of who's presenting and I'm like so excited. But I, I I guess so my supervisor, Dr. Legg, I really like geriatrics as well, actually. And she does a lot of like crossover between geriatrics and like rheumatology, which is really interesting. So I think she's presenting on like frailty in rheumatic diseases. So I'm really excited for that. And then Dr. Gladman's presenting on psoriatic arthritis and that will be very exciting to get to hear her speak. And then Dr. Vlikowski, sorry, he's our program director here for rheumatology. So I think he's presenting as well, or he's like chairing something. Uh, but everything looks so wonderful. So yeah, I'm not sure. Are
Well,
you looking forward to anything?
yeah, I'm just looking forward to, well, poster sessions are always my favorite.
So true.
I love poster sessions. I just when I've been to a few conferences and they got rid of like in-person posters or they, we put them on screens and I just don't feel like it's the same to be honest. But
Yeah.
I was there. Poster sessions is definitely my favorite, but all of
Oh,
those topics sound so fantastic, Lindsey.
yeah.
Yeah,
I
and
think the
that
whole conference is going to be so wonderful.
well, and is it your first time going?
Yeah.
Well, it is my favorite conference. I feel like some of the other ones are a little bit big. This one's small and cozy, and I will put in a plug. for the Canadian Arthritis Trainee Association. We'll also link them below. They will
Okay.
be get-togethers, go to their booth. I'll put that plug in there for you. Um, Lindsey, from your perspective as a student, new to rheumatology, do you have any insights or things that you've learned more recently where you're like, I wonder why patients don't do this already, or wonder why people aren't talking about this in terms of patients' disease journey, self-care or self-advocacy? Is there any insights you'd like to share with us?
Mm, I'm not sure. I think that the patients are so kind of resilient themselves because obviously, as you know, like a lot of these diseases are so difficult and challenging, I think. Um, and I think it's interesting, like for me, like yes, there's the rheumatic disease, but often that can kind of like be associated with a lot of other conditions like mental health issues and things like that because it is such like a burden. So or it can be, I guess. But I think a lot of patients are just like so um kind of like holistic in their care and when they kind of prioritize their health like in terms of like walking places and a lot of people like with arthritis are like very much prioritize like physical fitness it seems like because they realize like okay this is how I kind of will get through the pain or stiffness is like to move my body and things like that so I think that's really admirable and yeah. I'm not sure about what like they can do more of. I think I need more experience to be able to comment on that. I'm still learning from the patients, I think. Yeah.
Fair enough.
So
And
yeah.
you said something very important. You're learning from the patients, and I just want to double click on that. That absolutely we learn from the patients, and like you said, I think a lot of times patients don't pat themselves on the back and say like, "Yeah, I'm doing a really good job,"
So true. Yeah.
right? And like you said, like care is not just, am I taking my medications?
Hmm.
Am I adhering to my medications? It's also like, am I taking care of my mental health and my emotional health? And am I going on my walks? Am I doing things that are meaningful? Right. So, yeah, such an important insight that I will highlight here. And Lindsey, anything else you'd like to share with us before we let you board the plane and head all the way from Halifax to Calgary?
No, just thanks so much for having me. It was so lovely to meet you. So excited for the conference, so thank you.
We're excited for you. You'll have to come say hi to the team. And with that, Lindsey, thank you for your time. Thank you for sharing your insights. And thank you for our audience for tuning in. There's going to be many more episodes. So please check those out. And with that, take care, everyone. Have a lovely rest of your week.